Hello and welcome to the KSOGA, Karnataka State Obstetrics and Gynecology Society's podcast, Prerana Patha, a podcast which is a space for meaningful conversations with leaders shaping the future of women's health. We are your hosts, Dr. Kasturi Donimat, who will join us shortly, and Dr. Aruna Murlidhar, that's me. And today we have our president, Dr. Durgadas Asrana, welcoming our guest for the day, Dr. Padmini Prasad. And we have the privilege of speaking with a truly pioneering figure in her field that I'm going to talk about. Dr. Prasad is a senior obstetrician and gynecologist, Karnataka's first qualified female sexologist, and a medical director at the Ramamani Nursing Home and Maternity Home and the Institute of Sexual Medicine in Bengaluru. She's a founder president of the Bharavase Charitable Foundation, known for its motto, Reach the Unreached, Speak the Unspoken, and has led to impactful community initiatives in sexual and reproductive health across diverse and marginalized populations. She has served the profession in multiple leadership roles, including past president of the Bangalore Society of Obstetrics and Gynecology, chairperson of the Sexual Medicine and STD Committee of the KSOGA, National Coordinator for Sexual Medicine Committee of FOXY, and as an active member of international bodies such as ISSM and World Association of Sexual Medicine. A gold medalist and the recipient of the prestigious honor like the Karnataka Rajyotsava Award, Kempegowda Award, and multiple national and professional awards, she is also the author of 11 books on sexual and reproductive health in Kannada and English. In today's episode, we hope to talk about integrating sexual medicine into everyday gynecological practice, breaking taboos in the consulting room, and how we as clinicians can better address the unspoken concerns of our patients, which Dr. Padmini Prasad has been doing for decades now. Dr. Padmini Prasad, it's indeed an honor to have you on the KSOGA podcast, Prerana Patha, and over to Dr. Durgadas Asrana, the president of KSOGA, for his welcome address. Thank you.
Namaste and warm welcome to Prerana Path, the postcard series of KSOGA. Today, among us, we have Dr. Padmini Prasad, who is not only a practicing obstetrician, but also a sexologist and marriage counselor. We, the obstetricians, heal the physical illness of a woman, but she heals the emotional and social illness. What a holy act of rebuilding the lives of couples as well as the families. She started this movement when everybody was hesitant to talk about this sexual sexual problems publicly. She went beyond this taboo of the community to give helping hands to the needy people and to the couples. Her charitable organization Bharavase, really a ray of Bharavase, a ray of hope for those people. After passing her MD with gold medal, she could have chosen any subject like infertility, laparoscopic surgery, oncology, whatever it may be. But she chose this field to become the first qualified woman sexologist from Karnataka, only to serve the society by speaking on the unspoken subject and reaching the unreachable couple. Thus, she gave a new life to so many people and many more couples, and thus a new life to so many families. We can hear in so many TV programs and radio programs. And with this introduction, I request Dr. Padmini Prasad to narrate about her journey, which may be an inspiration to all, not only KSOGA members, all over Karnataka and India. Thank you.
We warmly welcome you, madam. Thank you so much for being our guest on this podcast.
Thank you so much. I don't know how much I can thank you for choosing me for this program. It is really a great honor. I really thank our president of KSOGA, Dr. Durgadas Asrana. I'll also thank you and Kasturi Donimat for engaging me with this conversation. Thanks a lot.
Indeed a pleasure, madam. Indeed. Madam, you've had an extraordinary journey. I mean, I don't even know how everyday consultations in your chamber happen. I'm sure there's so many stories that you would want to share with us gynecologists. What inspired you to specialize in both gynecology and sexual medicine, especially at a time when these topics were rarely discussed openly?
Correct. So, first of all, a gynecologist, in those days when we entered into post graduation, there were only four major subjects: surgery, medicine, gynecology, and P&SM. So, but in those days, whatever specialty you do, if you are doing a private practice or in your practice, more than 50% of the patients would be women and children. So because of that, though it was not of so much of interest for me OBG, I was more interested in medicine post graduation. But I took up this because just to have the detailed knowledge and in-depth knowledge to treat women and children. So that is about the gynec aspect. And the entry into sexual medicine is really, I think it is a destiny. It is an accidental entry and probably God's grace or God's wish that I had to enter. So this I entered into that at a time that is more than about 35 years ago. That time anything talked about sex was still considered to be obscene, unparliamentary, and also that it should not be talked about, a taboo topic like that. But because what made me, and it is not that I should enter this subject and something I can do, that nothing was there in my mind. And many were also asking, you are a lady talking about sex, how could you do this? So I just thought of as a doctor. And when so many patients used to come to me and they used to pour out their stories, especially the infertility, how the husband wife relationship, how the husband is not caring for the woman, and why infertility is happening, and some of the men using sex as a weapon to punish the wife, and the environment, and in what environment they were staying, and the family environment, emotions, and the relationship, which has got a bearing on the sexual relationship. All these things, when I was thinking, the knowledge which I had about this sexual medicine, because every doctor will know something or the other in bits and pieces about sexual health, but to have in-depth knowledge so that I can help my patients, that was the motivation for me to enter into sexual medicine. So that is the time I came across Council of Sex Education and Parenthood International, an all India body started by Dr. M.C. Vatsa, a very great personality. So that is the time I entered into that. I became a member and I did some distant education program, started attending national international conference. That is the only way that you can learn this. For 5 years, day and night, with sleepless nights, I just wanted to master in this field and enter, know more about it, because you know that there is no courses in India, whether undergraduation or post graduation. That is how I entered. And the another thing which helped me was that is the time when HIV/AIDS talk about all this safe sex and other things, something talk about the sex came into existence, and also the release of Viagra into the market. So to have it as a Ramabana for male sexual dysfunction. So the talk about sex become an openly discussable issue. And so all these things, I think it is a chance entry at that time. So it took it went into greater heights, I can say.
Custody, was there a defining moment in your career that shaped your approach to speaking
Yeah.
the unspoken? Was there any story which led you to talk about speaking the unspoken, reaching the unreachable?
Yes. I was just telling you because, see, gynecology and sexual medicine is an excellent combination, I can tell you, where you can give a holistic treatment to the woman and give quality of life to the woman. As I was telling you when I was discussing with patients, so many times how the sex is, because the major sexual relationship, the taboo attached to it, and how they are unable to speak about that. But still, some women did speak to me about these things, and also so many things which are of any disease, any surgery, or any medication can have a bearing on the sex or sexual relationship, which can cause the disturbance. I told you one couple, one infertility 5 years and a non-consummated marriage. I asked her why you're not consummated. Madam, there is only one room where everyone sleeps and we cannot have a sexual relationship. How can I conceive? And see, these things will not come to light. And another husband telling that unless you do all the housework, you look after my family, I will not give you sex. So this is one using it as a weapon. And so many diseases, extramarital affairs. And why do they go into extramarital affairs? And if the lady underwent a hysterectomy, the husband thinks that that is the end of sex life for him. And she is no more a woman. All these things made me think about these things. Then I thought, yes, there is something that I have to do it. And so only then, if I have the depth of knowledge, then only I can help these people to treat their problems, treat the relationship, because it is really so very only when you get into the depth of the problems, because physically you treat all the diseases, you do operations and you give medicines, but these things you never speak. Especially, you will not speak about these things to the couple, to the husband. We will not counsel the husband what he is supposed to do, why, how they have to behave, whether after a surgery, after delivery, during pregnancy. So these are all the moments where you start thinking there is something more that we have to do. Only when then you can give the holistic treatment, health, harmony, and happiness to the couple.
Yes, madam. Really brought the
Absolutely.
awareness of spoken, the unspoken. Really, it's a truth, you have done it. And really very, very proud to have you on this platform, madam, on this KSOGA podcast.
Thank you so
And
much,
madam,
madam.
just wanted to know, what are the challenges you faced as Karnataka's first female sexologist, and how did you overcome that? Because we know there are lots of taboos and then so much of this thing in the community about this. So we wanted to know the challenge and challenges to do the community work on in this aspect. That's so difficult.
Correct. Yes. When I entered, I was telling the earlier. So at the time when Viagra released and the AIDS came into picture, and some of the talk about sex was happening and through the media. And those days, you all agree with me, but there were only quacks who were self-proclaimed sexologists and who were capitalizing on myths and misconceptions of the public, and they were getting richer and richer, causing huge sums of money. So many, because this is an unspoken subject where they will not, they go to the quacks and get problem, but they cannot discuss it with anybody and cannot say that we went to this for this medicine and we went for the sexual problem. So that became a hush subject for them. So that is the time when I entered, when I did this. So one of my friends who is editor of Udayavani, Purnima, she said, see, if you just put a board, nobody will come, they will only mock at you and they think you are another quack practicing sexual medicine. So that should not happen. So because I had to give this, I had to tell the scientific facts, medical facts, and tell the truth, the real facts about the sexual health and sexual medicine. So that is how I had to enter when there were only quacks who were treating, because medical people were not prepared to treat such things or take history or anything. And during this time, after I started writing, I started writing a column in Udaivani. For 23 years, I wrote in that. So people took it so well, and they started pouring all the private problems which they had. And most than 50% of the questions were from students, high school students and college students, about their body growth, about the genital growth, and about the menstruation, premarital relationships, and what to do if I get married and I have had a relationship with a boy, or the boy they died after I got engaged, and what to tell to the other person, and so many questions, and the men asking so many questions about their personal problems. So then you can understand, daily I used to get, nearly every month, thousands of letters I used to get. So gunny bag full of letters I used to have. I had to answer, collect all that and answer that in a proper scientific way. And at the same time, the television channels and the radio, really I should thank profusely the media, which became a bridge between me and the public. And we could create one silent revolution in the field of sexual health. That is how publicly I could speak about it in a very proper language, which I could communicate even there. So people started telling me, at least medicals are, only now we came to know that medical things also could be spoken in our own language, Kannada. So even an even illiterate person can understand what it is. So the amount of love, affection and respect which the public gave to me, it was really a overwhelming response. So one after the other, different channels, late night programs and continuous programs. That is how really it is. I should thank God for giving me such an opportunity to create such a big public awareness, remove myths and misconceptions, prevent so many suicides and prevent so many of their sexual problems. So that is how people started accepting me. So at this juncture, I must also say the professionals did not appreciate or did not so take it so well in the beginning, and what is there in that and what is that she is going to tell, which we don't know. Yes, all the doctors do know about that, the anatomy, physiology, hormones, but in depth about the sexual matters, there is something different. So that is how I could at least bring it to the notice of the public and how I could explain it to them. So people started understanding because it is concerned with every person. There is a difference between sex and sexuality. Sexuality is the most integral part of every individual, right from the birth to death. So, right at the time of gender assignment, whether a boy or a girl. So, later, how they are shaped differently as a boy and girl, their childhood, puberty, marriage, husband wife relationship, pregnancy, childbirth, menopause, post, all these are different dimensions of sexuality. So, it has to be looked at it as sexuality. The sex, which is just a physical relationship with either a gender, male or female or transgender, or a intercourse relation, it is only very small portion of overall sexuality. So this is how I could remove the myths and misconceptions with lot of public programs, lectures, school education. So all these things I started bringing about the adolescent, the growth, the body, understanding about the body, and how so many misconceptions in children, it is causing problem to them, the anxiety, the suicidal tendencies. So all these things came to light, which I could address and take. So that was the challenge and how I could get into that. And media really played a very big role, I can say.
Hats off to your work, madam, for the public and for the children. Otherwise, they were
Yes.
going in the wrong hands and getting a wrong information. With
Yeah.
that, they were
Correct.
misguided. But you have made a huge difference in the society by your guidance. So, really, you have really made a difference for large extent of the society, the youngsters, and get a correct guidance for them. And through your foundation,
Yeah,
madam,
absolutely.
Bharavase Foundation, you have reached some of the most marginalized communities. Can you share a story that highlights the
Correct.
impact of your outreach through your foundation?
See, because as I told you, because of the media, television programs, even any village, any person, whether they don't have anything in the home, but everyone will have a mobile and the TV. So that is how I became one familiar face to even the remotest village. If I go also, as soon as they looked at me, they used to talk to me with so much of respect, love, affection. And I just cannot describe the amount of love, affection. They used to come in groups and they used to come so in large numbers just to meet me, and they wanted me only to talk to them and then treat them or give so that because even now, though they know the lot of health consciousness has been there among public due to the health columns, health programs, and other things, and so many camps being conducted, but still women are scared to go to the doctor. And what will they tell, and what some diseases I will know, and all that. So these things were there. So many when they used to come for the first time, I had detected so many diseases. So many, it is so rampant about even the simple diabetes, blood pressure, thyroid problem, and the calcium deficiency, and about the menstrual problems, bleeding, severe anemia, and the cancer awareness when you create it to how they can do the self-breast examination, and any of these problems, how they can come to the doctor. So the counseling part of it and creating awareness. That itself was a very big thing. And doing pap smear, HPV testing and vaccinations, that apart. As a gynecologist, you all have been doing that and you know the impact of that. So in addition to that, so some they used to bring their men also in between. Madam, my husband has got some problem. See, this is the change you can see. In olden days, the men used to come for the treatment. Men used to bring wife for that some problem. But now women are bringing the husbands, telling that he is not, he has become weak in the relationship. He is unable to have proper intercourse. He discharges soon and he is not having proper so boldly. So they have accepted. And this awareness has been created in a large scale. So that is how the people have become comfortable. Even if you go to the rural places, urban downtrodden rural place, all these things we have arranged. So that is how, then with the help of the local people, of course, and the doctors, ASHA workers, and the primary health centers, they all used to participate, and we used to have really a big, impactful places or impactful programs that we had, mega health camps. That I can say.
How did the
Really?
Bharavasi Foundation come through?
I told you that people gave me so much of love, affection, awards, felicitations, and other things. So then I thought now it is the time for me to give it back to them. They have given me so much, I must give it back to them. Health is everyone's right. Nobody should be denied of any healthcare facility or treatment, or nobody should die because of lack of treatment or unable to afford treatment. So when you go to their doorsteps and give them what they want, at least detect diseases and guide them, and then see that they go to the doctor at early detection of diseases or prevention of diseases, and how you can motivate them, and they should speak it. That's what I was telling you, speak the unspoken. So come out of your problem. Don't hesitate. Even with nowadays, you see less cases of big prolapses and big things, and because early some at least some amount of awareness has been created among public. So it is, and with and the teaching the men also. So when you are there in the family, take care of women, because she takes care of the house, your husband and children. So when she is sick, when she has got a need, at least go for some regular checkup, even if she is normal, yearly once or 2 years or 3 years once, and get her checked everything, so that her health is very important for your family health. So that is how we have to create awareness when you go there. So that is how this our Bharavase Charitable Foundation started. I have got a we are doing a very good work in these things and creating awareness, vaccination programs, and preventing diseases. So these are all happening in different villages all over Karnataka. And I have got a very good director who arranges and takes a lot of pain. So Geeta Uchil, I have one director also. She does a lot of work in this, and people have become very helpful in arranging things also. Thank you.
Uh, you have done so much of work. How do you encourage the other healthcare professionals, other doctors, to be more open and more supportive for the women to have this kind of environment and to discuss these sensitive topics, and supportive environment for this?
For the woman to speak about this thing. See, first thing, there has to be training. I really want this policymakers or the government to have undergraduate and postgraduate courses in the sexual health itself, sexual medicine itself. So more and more doctors became aware of what is happening, and you have to be very comfortable talking about the sexual matters. So remove that obscenity, give dignity to the subject. You talk it as a matter of fact thing. So training. So we study so many things and we see so many patients. But I don't think there is anything which is taught about the communication, counseling, and because showing sympathy, empathy, and then understanding the patient's problem, the relationship problem, the husband-wife relationship, and how they are dealing with that, and how they have to deal with the sexual problems. So unless you know about all these things, you cannot become a good counselor or a good treating doctor in the sexual health care. So that is first of all the starting the courses, teaching them about these things, and train people. Train the doctors, train the courses, train the teachers who can teach in the sexuality education in the schools, colleges, and create, see, in a government hospital or a big busy practitioner, if there are 10 people surrounding you and one girl is having some premarital problem or she has conceived or unwanted, unmet motherhood, how can she come and discuss about these things? And how can she discuss about her premarital relay? So there has to be privacy, confidentiality, and you have to become very comfortable talking about these things. Don't be judgmental to the patient. And when you are telling about these things, it is also important, don't impose your morals on the patient. Whatever problem she has come to you, you treat the problem. That is your way. Later, slowly with counseling or telling or what is the situation and all that is apart. So first treat the patient, and at the same time the vocabulary, the sexual words which you use, and so many people will not tell you in a direct way the sexual slangs which are there in the society, how they describe the genitalia. Even today we don't in the households, and nobody will speak about genitalia like vagina, vulva, or clitoris or anything like that. We don't give names to that. Some other names we give. And we don't teach children how to be comfortable with their own body and how they have to protect themselves and how you have to teach them. So that is where creating a positive environment and giving a positive attitude to your own body and about the sexual matters, about the names. So these are all very important. Even a small child, if it as a part of exploring its body, if it touches the genitalia, immediately the elders will shame, shame, puppy, shame, don't touch that. And so you are creating a negative attitude right now. Oh, this is not a part to be touched, not to be talked about. So even if the child suffers from any injury, infection, or a problem, or somebody misusing, he does not know how to express. So, right during childhood, during this, when you're just giving birth to the child or telling stories, putting it in your lap, so that time you tell like a matter of fact, this is your body, you have to protect your certain organs. So you have to protect it. The covered parts should not be touched by anybody because it may hurt you. If somebody does it, you come and tell me. So all these things children will start learning. So they give that type of positive attitude. Then again teach them during puberty. Before they enter into puberty, tell them what are the changes, physical, mental, emotional, and sexual feelings, how to handle the sexual feeling, how they can prevent high risk sexual behavior, and how they have to behave with the opposite sex with the mutual love, affection, not encroaching on their privacy, not misusing. Bachao, beti padhao, in that the beta samjhao. So teach them both how they have to respect each other. And when they come to the marriage age, give them premarital counseling, the importance, how they have to respect each other. So many problems in society like sexual abuse, rape, the dowry, all these things can be prevented if children are brought up with a proper values. So that is what a healthy, culture appropriate, age appropriate, value based sexuality education. That is what we look at it.
Madam, so we all, I'm the current chairperson of the Adolescent Health Committee, and we have members who are actively involved in doing school and college programs, as Dr. Kasturi and Dr. Gudugada sir know. Now, the main thing that we come across is when we talk about sexuality in children, early adolescents, mid adolescents, late adolescents. Obviously, there are different ways that you talk to earlies
Yes.
and mid and late adolescents, right? Most of the times, when we talk to children, both the genders, we try to separate them. The girls we talk separately and the boys we talk separately. In your experience, what are the most common myths and misconceptions that you encounter in early, mid, late adolescence? And if you were to be giving a talk to them, how do
Yeah.
you handle such myths and misconceptions?
Yeah, see, one thing which I have observed, so many people when they say school education, adolescent education, they talk only about menstruation or some hygiene or some food or diet or whatever it is. So that is not just an adolescent or sexuality education what we are. It is physical, mental, psychological and sexual aspect.
Yeah,
All
that's
these things become important. in a stepwise manner as per the understanding of their age and their brain development and whatever they understand. So this is that initially early adolescent you were telling. So initially when they enter into that, they are so much, they want to explore their body, their sexuality, and they take more care of the body and spend lot of time in front of mirror and in the bathroom. So you will be scolding them and then spending so much in front of that. This is part of the growth that one others have to understand. First is the self love, then the peer love. The peer that with the same age groups, and they spend lot of time and discuss. So whatever they say, that is important, not what parents say is important. So they become so attached. Then comes the heterosexual attraction or some other attraction, whatever the expression that is there. That is the time during adolescence only they develop this attraction also, sexual attraction, either to the opposite sex or to the same sex. So it develops during that time. You will be really wondering, I usually mix both. So boys should know about girls, girls should know about boys. What is happening nowadays? The children are very smart. They have got all the information. They go to the net. They see everything. So everything, the advertisements in the sanitary pads in there, so the boy will ask what is it and all that. So everything they will be knowing. And the questions which they ask, I usually ask them after I give a talk. I tell them, you write in your chit what question, any question, I will answer. So you need not tell your name, who has asked the question. They asked about masturbation. They ask about nocturnal emission. They ask about homosexuality, the lesbianism. They ask about menstruation. They ask about the body growth. They ask about their genital growth, the breast development, everything they ask. If you just give a talk and then you talk about their just development and menstruation and what is there, and separate the boys or the girls, and so it is not necessary. When they are together, let them understand what is menstruation, what is the boy is suffering, like how the menstruation starts, and you teach your daughter that the menstruation, maybe the, leave alone the other changes which happens in the body, but at least that is the first sign of maturity for them, for the girls. In a similar way, for the boys, when the nocturnal emission starts, that is equivalent to the starting of menstruation. For so so many children are so scared about nocturnal emission. That is just it, they are growing and maturing, genital organs are developing, and the semen is developing. So that is a nature's way of discharging. The old semen has to come out either through nocturnal emission or through masturbation or through intercourse. So this is a very common and very normal natural process of the body. No parent will tell the boy about these things and about their growth and about the genital growth, the penis size, and only they ask their friends or some servants or somebody. And they also give wrong information to them. They get so scared, and so many children I have seen, the children, the very intelligent students and children of doctors, I can say, they come with so much of tension. So my friend said, you can never marry, you cannot have the child, and you will be suffering, and this is, you are losing semen, losing strength. So all these misconceptions, how much they are there, and children and college and these students suffering, you can understand. So about the growth, about their body, about the development, and sexual attraction will come, because that is the time when there is biological maturity and sexual biological capability, sexual maturity will come at that age, and how they have to handle those sexual feeling. It is there in the mind, but have the diversion, look into the priority, and go on talking to your people and parents until then. Parents should supervise at this, because some children become very silent, some are argumentative, some are quarrelsome. They want to argue for everything with the parents. Children are different. What they want is guidance, acceptance, not calling names, and then give them respect and appreciate them. So that really does wonder. Not nagging and calling and quarreling and telling. So these things will not work. So these are also very important to tell them how they have to handle. But at the time when they finish the degree or come for marriage age, then they tell them come for a premarital counseling. What you have, what is marriage, what is husband-wife relationship, what is intercourse, and what you have to expect, and what disturbance can happen. So many problems in the society you can prevent, and the divorces, disturbed interpersonal relationships, all these things can be addressed if you go step by step to teach them. So when you do the school education program, you have to keep all these things in mind. Then the children will accept you, understand you, and appreciate you. That whatever they wanted, you have spoken to them, in addition to all the other things what you have spoken about.
Absolutely, absolutely true, madam. Yeah, so that's what we're trying to do in our KSOGA modules. We're trying to introduce not only the physical, element, but also the mental, psychological, digital, and several other,
Yeah,
parameters as well. And it
as you
makes so much
said
of
that,
sense.
sorry, as you said, it's very important because of the present day of internet and then pornography are getting the wrong sexuality education. It's only they're stimulating their mind and getting into experimentation. So all this cyber crime, cyber bullying, and then getting into bad company, all these things should be told to them about.
Kasturi, madam?
Madam, yes. Madam, you are on so many global platform and member of so many international organization. How do you see India's progress in compared to the
Yes.
other countries? How is the global trend in this aspect, madam?
I can say India is no inferior. Our people, our doctors are treating and they can match the global standards. But only in the field of sexual medicine, still, as I told you, the teaching and the training is not there. A proper teaching, training, and university education, and the recognition by NMC, all that is not there. But still, there people are doing, and some fellowships and guidance and the conferences. And I have been a member of International Society of Sexual Medicine, South Asian Society Sexual Medicine. I have been treasurer and member in the committee, and also in the Journal of Sexual Medicine. I am in the editorial board committee, and member of World Association Health. I have attended so many international conferences. And really, the knowledge which is what we have and what they have, it is really we can match them. The thing is, because they have got post graduation, undergraduation courses, university education, they in a systematic way they will learn things, and it's very difficult for them to accept other things in from the European community and also the America and other places. But still, they have recognized some of the doctors from India, and I have been a part of their webinar and then discussions. I was also a member for International Consultation of Sexual Medicine, who is the authority who can give recommendations for in the form of definition, treatment, and other things. So this it's a very great exposure, I can say. So that whatever misconception that we have, whatever misconception myths that we have, it is all same all over the world, I can say. This it is not that we in advanced countries they don't have any myths and misconceptions because they are more open and also promiscuous and all that. It is not there. Whatever that is there all over the world, it is also there in India, and there is some cultural influences in different parts of the body, in different areas. There are certain different things because of the cultural influences and the local understanding of the relationships. That much I can say.
Sure.
Really very happy. This is, I can say that it's a very good development among the doctors. They are understanding the importance of getting training in sexual medicine, and how important when you are really counseling or treating a patient, whether it is pregnancy, whether it is menopause or infertility or any operation, it is very important how you deal with it. In addition to all the advices, give openly give advice regarding the sexual relationship. Talk to the husband, talk to the woman. So that so many myths are they are hesitant to ask doctors. They think
Yes.
they may be ridiculed if they ask about these things. So that comfort feeling you can give to your patient, and you see really you can do wonders in the woman's
Right,
health.
ma'am. Wonderful. I mean, that it matters so much to spend those extra minutes understanding their sexual life and, essentially help them in that way, because we all know that sex itself is a great stress buster and can, in fact, get rid of many of the mental health issues that couples face nowadays. Madam, how much do you use the services of a urologist or a sexologist for male factors in your practice?
No, I myself treat them.
You treat them, right?
I
So you
treat male
do
sexual
not
dysfunction, female sexual dysfunction,
ever.
couple, because now that the people know that I treat these, I talk about these things. Most of the cases I treat. In fact, so many diagnoses I make. For example, some of the anejaculation, some delayed ejaculation, and blocked seminal vesicles, tubes. All these things I myself will diagnose. So many of the problems which the males have. And one thing they have to understand, because many people, when they come for erectile dysfunction, so that is one symptom of a basic, some other great problem in the body. So it can be a first indication of diabetes, it can be first indication of cardiac disease, it can be first indication of metabolic disorder, and it can be an indication of depression or psychiatric problem, or it can be the first indication of the prostate. So it is a symptom, and you have to give so much importance which starts first can be in that. And there are so many without any reason any normal person can have sexual dysfunction. So four things, if you understand: a desire, arousal, intromission, orgasm, and then the resolution. Any of these places where whether there is a desire problem, whether there is an arousal problem, whether there is problem during the epinovaginal intromission, whether there is a problem in the orgasm or the climax, where is the problem? Just ask four questions and you know where is the problem. Just according to that, you just start asking questions, investigate, treat them properly. So it is not that everyone thinks that they have to spend lot of time when they are dealing with sexual problems or the health. No, certainly not. When you start asking, when you start dealing like this, it becomes very easy. Make it a part of your overall history. So it doesn't take much time. So any time in during pregnancy, if they ask about, you only volunteer and tell them how they have to maintain the relationship, or you tell them post delivery when they can start the sexual relationship, or after hysterectomy or genital surgery or the pelvic surgery, how they have to, how much abstinence they have to have when they can have this. So this is because recently there was one person who came, 75-year-old man who had undergone cardiac bypass 10 years ago. And so apologetically he came and asked, doctor, can I have sexual relationship? Then I said, why not? When did you not ask your doctor? No, when I told my doctor, he told me, you be thankful to doctor, the God that you are alive. Why do you bother about sex and other things? So if such advices are there, then it is you're immediately snubbing the That's why whenever a person comes, whenever they talk about sexual matters, be very sensitive to their problems and find out what it is. If you cannot deal with it, certainly refer them to their concerned doctor for a proper counseling. So that is how the doctors should become sensitive to their problem, empathetic, sympathetic. That's what I was talking about. So, if every doctor makes it a point to talk about this, become sensitive to that, understand their problems, either you handle it or, if not possible, refer them to a proper person. So, that is how you can deal with sexual matters.
Now, just to complete this question, how much of your sexual medicine practice is multidisciplinary? And if it is multidisciplinary, do you have a psychologist, counselor, urologist, or a
Yes.
physician who
So that
complete
when
the
yes, whenever there is a need. For example, like one person they comes for he comes for a case of premature ejaculation or erectile dysfunction. He's got phimosis. Then definitely I have to refer to the surgeon for the operation. And if it is some psychiatric problem or psychiatric medication which is causing him erectile dysfunction, so many are there who are on antidepressants, anti-anxiety drugs. That is, as a side effect, they suffer from ejaculatory problem and erectile dysfunction. So they come again for the treatment. So then either we have to adjust it or give some other erectogenic drugs or other things. That is important. So during marriage counseling, some of them have got some of the diseases, and they come and ask you whether I can marry and how much I can do that. And so many men, just because of the performance anxiety and masturbation guilt and the nocturnal emission, they will be just canceling the engagement, postponing the marriage 30-35 years. So parents will bring them. So he is just postponing marriage. I don't know why he is doing like that. Two times he got engaged. He said, no, no, I cannot marry. And he will come and tell, no, no, during younger days I had masturbated so much. I am so much worried whether I can give happiness to my wife. So I am hesitant to marry. Just clear the misconception. Tell them how that it is. Masturbation is, unless it becomes a compulsory masturbation or with bag and baggage. And he told me once, and no, no, doctor, as a last doctor, I'm meeting you. If I don't get any relief, I come with bag and baggage from my home, and I am going to commit suicide. If you then you tell me what I can do. He was just a masturbation guilt, and he was worried that he cannot marry. You clear the myth and misconception. Now he is married with 2 children. And that day he would have committed suicide otherwise. So these are the so many practical things, the umpteen number of cases, if I go on giving you example of how sexual dysfunction, just a myth, can create problem to the person or to the spouse or to the couple. So that is extremely important.
Madam,
So motivated.
Yes.
What keeps you motivated after such a long tenure?
You had to have a positive attitude. People's patients' happiness is my happiness. I see that is my relaxation and reward. If the people are happy about, once they are relieved of the silent suffering, that itself is a motivation. So keep yourself busy from morning till evening. Don't have time to brood over the ill feelings or the things and other things, and try to help people as much as possible. But this really has given me a lot of happiness to go into the depth of someone's very private things and the problems which they cannot tell anybody, to the parents or to the friends or to the teachers or the spouse, and they can come and discuss only with you and not with all the doctors also, I can say. So that is really something which God, if God can allow me to help that person to relieve the silent suffering, so that itself keeps me motivated. I should treat more and more patient, help more and more patient. That is the attitude.
such beautiful thoughts, Madam.
Really
Lovely.
commendable, madam.
Madam, what are your hopes for the future of women's health and sexual medicine in India? What is it that you envisage
Yeah.
going forward,
Yeah, we all, as gynecologists, we always interested in women's health. Give her the quality of life and hope, and then prevent maternal mortality. Give her this infertility, treat her, give her a child. So, in addition to that, give her a health, harmony, happiness through treating her even the intimate sexual and reproductive health. They are combined. Reproductive health is part of sexual health. It's every woman's right to have proper sexual and reproductive rights we are giving them, so that with that pleasurable and safe sexual practices without any abuse, coercion and cruelty. So that should be for every woman, and whatever in that best interest, whatever awareness we can create, whatever we can do that. But still so many things are happening, sexual abuses and marital abuses, those things are happening. But if we can give them a proper counseling, give them the proper life, that is really, I feel it is great. And every woman should help the other woman. Each one help the other woman. And woman should not be an enemy of the woman. And see, we are we want love, affection, mutual cooperation, coordination from the other gender. So it is not that we are not activists. We are only just helping them, make them understand that mutual cooperation, coordination is important. All the children should be brought up with that, and there should not be any ego or anything like that. And so many laws and other things should not be misused. We are not anti-man. We need man's cooperation. We are like as you say, the both of us should walk together, not one behind the other. Now it is not a God devotee or Pati Parmeshwar relationship. It is more of we are friends and we are equal to one. We are all equal. We are all moving forward. So with that attitude, we have to go, and every woman will have that, and every woman should have the right for health, right for the bodily integrity, right for the her happiness and pleasure, and a healthy sexual relationship.
That's so true. That's so true.
Madam,
And so well said. Yeah.
Madam, you are so busy
Go ahead,
always in
Kasturi
your
ma'am.
professional work and social work. How do you balance your personal and professional life?
Yes, for you all are doctors, you all know how difficult it is. We have to do the multitasking. We are interested in our family also, profession also. So somewhere we had to do the balancing, and I am always there for any of the family functions and social functions for my children or husband. I only will cook. I have not kept any cook for that, so that with our own cooking, and it's our pleasure if our people. So I used to adjust because it is more of a private practice. I used to adjust all the elective things, outpatients and other things, where it will not clash with the children's presence at home. So when children are there, I try to make use of that time to be with them and see their progress and talk to them and all that. So but emergencies, as you all know, you can't help it, and family cooperation is extremely important, and lot of sacrifices will be there from our side also, and from the family side, husband and children. So this is we should take it, though we feel guilty at times, we have to take it as part of the game. And my family has been very supportive and very accepting of my busy schedule and other thing. But most of the important events or whatever that is there, I am always there for children and the family.
That's so wonderful. Would you have any advice for youngsters who would like to take the untrodden path like you did? What is it that you'd like to, tell them, the ones who are listening to our podcast?
Yeah, definitely. Nowadays, children are very smart compared to our generation. They're extremely smart, well informed. But somewhere they should have that how they can have love, affection, and the cooperation, and understand others also. Go to their shoes and understand, and have focused attention whenever whatever field you take, whatever there, be focused and enjoy the path to the goal, enjoy the journey, and have some discipline. And also, so of course, commercialization has come in all fields, so we can't help it. But this more than money, it is also important to have the happiness of the patient and how you treat, and the amount of happiness that gives when you treat a patient and then get that happiness, see the happiness in the patient's mind. That is more of a reward for you rather than any of your money or anything. Of course, money is important, but we should also, most of it should be an ethical practice and have morals, have discipline, and be focused, and help as many people as possible when you are into this profession. That I can say.
Excellent. Very well put, madam. I think Dr. Padmini Prasad, Madam Kasuri ma'am, would you like to add any other question?
Uh, how do you, madam, you want the listeners to get involved with your mission? Means your foundation, Powerse
Yeah.
Foundation, to help the society.
So anybody is most welcome, and it is all. It gives a pleasure to be with the public, be with the people, create awareness, and do the counseling. They can help us with cash or kind, or involved with that, and arrangement of camps wherever they arrange and whatever they want, and then we are always ready to help them go and work for them. So that is when I can give the phone number of the foundation. You can, if somebody asks, you can pass it on to them. And anybody who is interested doing this social service or community work and creating awareness and women's health, certainly we can be a part of it.
Absolutely. Sure, madam. Thank you.
Really, very nice.
um, Dr. Padmini Prasad, ma'am, thank you so much for this rich, candid, and insightful conversation. Your work in bringing sexual medicine into the mainstream of gynecological practice and your lifelong commitment to speaking the unspoken is deeply, deeply inspiring all of us in the profession. And to our listeners, fellow gynecologists and women health specialists, we hope this episode has given you practical perspectives on how to create safer spaces for patients, address taboo topics more confidently, and extend our role beyond clinical care and advocacy and education. Over to Madam and Durga Das sir for their final comments.
Really, thank you, madam. Really, you have spoken the unspoken. You have touched the untouched topic, this thing, and you have inspired all the listeners to help the society and the families and to save many families by your talk. So many you have inspired, and then many will be proactive in talking about this after listening to you. And I think some training everybody has to undergo so that they talk what is physiology, anatomy, and then save families. You have really saved so many families in this country. So it goes a long way in their family life. Thank you so much, madam.
Thank you, madam. Thank you.
Thank you, Dr. Padmini Prasad. It was a very crystal clear message. I remember you were the chairperson of KSOGA in the sexual committee. You had done so many educational programs, and because of those programs, you have bagged the best committee prize. I was the one at that time. And
Yes,
also,
thank you, sir.
yes, and also you have performed a community camp in one of the remotest part of Tumkur. We were together. I can see
Yes.
the crowd surrounding you till 6 o'clock in the evening. That is the baravase that they have on you. Thank you,
Yes.
KSOGA. Really immensely thanks you. Even in the middle of all your busy schedules, you have come and accepted our invitation. Thank you very much for spending time with us. Thank you.
It's really a great pleasure and an honor for giving me this opportunity. Thank you very much.
Thank you very much, madam.
Thank you
And
so
for
much, madam.
those listeners who've joined us on the KSOGA podcast, do subscribe, share this episode with your colleagues, and stay tuned for more conversations with leaders in women's health. Until next time, we, your hosts of KSOGA Prerana Patha, sign off. And thank you, Durgadas sir, once again for this opportunity. And thank you so much, Padmini ma'am, for spending your time with us. Very, very insightful conversation indeed. And we hope that many gynecologists will start making questions about sex a part of their conversations in their OPD chambers. Thank you very much.